Jessica Santer. I've just joined Southampton, which is the concert hall at university. I've been there about 2 months, but my career up to this point, about 20 years, I've worked in arts participation. Most recently, before joining Southampton, I was head of creative learning at Southampton Centre in London for over 10 years, and we did a lot of work there around arts and health and wellbeing. And I'm going to talk today, my details are there, feel free to contact me if that's useful in any way. I'm going to talk about different types of arts and health projects with examples of each, and really just to kind of hopefully express how the arts can be really beneficial to our health and wellbeing in lots of different ways. And some of you probably have some of these ways already. But I want to draw attention, if you've not already come across it, Creative Health, which was a report that was published in 2017 by the All-Party Parliamentary Group for Arts, Health and Wellbeing, and is a brilliant publication all around arts and health and the opportunities and the challenges and all the rest of it, but throughout it has lots of great examples of projects, and you can download that. So the 4 different types of kind of categories of that I'm going to talk about is arts participation projects, which I think are indirect approaches, arts and health intervention projects, arts and learning environment, and arts to educate and raise awareness. So arts participation projects, I think of as sorts of things that happen in this building all the time, the next room last as well, and so there's projects that engage children, young people, schools, adults in participating in the arts, but don't have a primary kind of health objective. That is still improve our wellbeing by creating a sense of belonging, shared purpose, improving confidence, friendships, and sense of achievement. This is a group from Southampton called Connecticut Blockheads, carnival drumming group that has some school every August, working up to National Carnival, and then they perform at the carnival. And you can just see how much they're loving it, and that sense of kind of shared identity as a group. And they're not it's not a health project, but they're improve well-being. And then arts and health interventions, opposite to that, if you like, are projects that very specifically set out to improve arts and health around a specific health condition or symptom or public health, and they bring together arts and health professionals collaboratively, so we've heard about some examples already. The impacts of the projects are measured, and they inform arts and health practice going forward. And this project I'm going to tell you a little bit more about. So it's called Melodies for Mums, and it's a project that is for women experiencing symptoms of postnatal depression or postnatal anxiety. And it's run by an organisation called We Arts Health Research, and they grew out of Guy's Hospital in London. And they do other projects as well. I really encourage you to look them up. They've got some really great examples. I was talking to Lou earlier here, who's an occupational therapist, about a magic project that they run for children with confusion. And they also run a really great project for a fall prevention project in dance. But Melodies for Mums is a singing programme that addresses depression. And it's a initially research led by Royal College of Music, Imperial College London, and Breathe, the organisation. And through the research, their results show that participation in the project can lead to recovery of postnatal depression in 73% of the mothers aged apart. And after just 6 weeks of singing, mums have experienced a decrease of nearly 35% of their symptoms, and 65% have no longer had moderate to severe symptoms. The project, I'm going to show you the film so you can find out more about it, but it's now part of Shaper, which is a really well-funded project funded by Wellcome, which is about shaping up, sort of scaling up arts and health projects. So there's 3 projects part of the programme, and then these kind of scale. So it's really to be blessed.
I was knackered. She didn't sleep at all. She hadn't slept for a really, really long time. She was like waking up every 30 to 40 minutes.
She wasn't breastfeeding very well. I wasn't breastfeeding her very well, and it was quite an emotional period.
You are absolutely in your own little universe that only contains your brain and this little blob who's crying and you don't know why.
So we'd taken 150 mothers who had symptoms of postnatal depression and randomised them into 10 weeks of usual care, 10 weeks of social groups, or 10 weeks of social singing groups. And we found that those in the social singing groups had significantly faster improvements in their postnatal depression, across the 10 weeks. And in fact, about 3/4 of them had recovered from their symptoms by the end of the 10-week project. And this was about a month earlier than either of the other 2 groups.
Off we go, bella mama, yeah. Bella mama, yeah. Wow.
I remember the first melodies for mums that I went to, and it made me cry because I just felt quite invisible at that point and quite useless. And I think that having something that I could do with her made a real difference, and it just was something to look forward to every week. And things started to get better, and the feeding got better, and she started to put on weight, and as you can see now, she's a perfectly healthy weight. And it really, I think it was a turning point for me.
This project really supports the mum. It's not just all about the baby, which I think a lot of services provide. This project is about saying being a new parent is really difficult. And this is something for you as well, as benefiting a child. So.
Riding the new river train. Riding the new river train. Same old train. Same old train.
We learned so many melodies. I couldn't sing to her. I was just like, I was shy to sing up to her as well. And right now, I'm just doing my own music for her, which is great. And she loves it. She absolutely loves it.
Here we go, guys. Let's try it.
I can't stress enough how important it is to have something to go to. And then when you get there, when you get here and everybody's just, singing and the babies are so happy making noise, and it really, I think, is able to pull somebody out of their own heads and be able to help them look around and see how nice everything is. Huh. How nice it all is. Yeah, especially when there's tambourines.
And I think to that project, Rosie, who's still there leading the group with the blonde hair, she is a graduate from the University of Southampton and was really involved in Tennyson's and the music programme when she was a student there. So so that project I think is just a really great example of very clear objectives around a specific health condition and symptoms, a really thorough research study, and now kind of rolling it out. So another example, another sort of category, if you like, is arts in the medical environment. So this is when the arts kind of, starting to come up with arts in hospitals, doctor surgery and different places like that, and how that can really improve the experience. And that can be visual arts, it can be art on the wall, it can be read work, it could also be performances, concerts, and activities to support the staff as well. We've got a photo here of half playing at their side.